Like solid marble, our teeth are built to last. But over decades of daily use, tiny hidden fissures and surface wear inevitably start to appear. By the time we reach our 50s, dental work shifts from fixing the occasional cavity to structural maintenance. A damaged or weakened tooth often requires a crown or a bridge to continue functioning. When your dentist recommends this kind of restorative work, you face an immediate choice. Do you stay with the NHS, or do you pay out of pocket for private care? Look at this comparison of 2026 UK baseline costs. On the NHS side, a crown carries a fixed Band 3 charge, £332.10 in England and £203 in Wales. In the private column, the exact same treatment jumps to anywhere between £500 and well over. Both the NHS and private dental sectors in the UK operate under strict regulations and high clinical standards. The decision between the two rarely comes down to whether the tooth will be fixed properly. It comes down to a direct trade-off between keeping your costs low and having control over exactly how your new tooth looks. The biggest driver behind that price gap is the raw material used to build your new tooth. To see how these materials stack up, let's map them out on this chart. We will measure them by aesthetic appeal on the horizontal axis and physical durability on the vertical axis. We will start with the standard NHS Band 3 crown. These are typically made from a gold alloy or other mixed metals. Metal is incredibly tough. You can expect 15 to 20 years of solid chewing out of one. However, because it sits entirely outside the natural color spectrum of a human smile, it scores very low on aesthetics. Now let's map the standard private option, porcelain fused to metal or all porcelain crowns. Porcelain gives you a bespoke color match that blends right in with your natural teeth. The trade-off is structural. Porcelain is slightly more prone to chipping than metal, usually lasting between 10 and 15 years before needing replacement. Finally, there is the premium private option, zirconia. Zirconia is an advanced ceramic. It pairs the high-impact durability of a metal alloy with the natural translucency of porcelain. It also requires the highest upfront financial outlay, usually starting around £600, and is entirely unavailable on the NHS. A private fee secures an invisible repair and maximum bite strength. The baseline health of the tooth is the same either way. Beyond the physical materials, you also have to navigate the structure of the NHS billing system itself. The NHS operates strictly on clinical necessity. If you want to bridge a gap purely because you dislike how it looks, the NHS won't cover it. The tooth must be compromised by decay, trauma, or a large filling. Let's look at this scorecard to see exactly what that NHS Band 3 charge covers. The $332.10 fee successfully pays for the crown itself and the appointments required to fit it. Here is where patients get caught off guard. That single fee omits cosmetic requests, and it excludes the preliminary work needed to save the tooth in the first place. If the damaged tooth requires a root canal before the dentist can place the crown over it, you will be billed a separate Band 2 charge of £73.50 on top of your final bill. The NHS provides highly cost-effective restorations, but the pricing structure is rigid. If you expect a single flat fee for a complex repair, those separate preliminary charges will quickly alter your budget. There is also a distinct difference in how your time is managed. High-volume NHS laboratories typically require 2 to 3 weeks to manufacture and return your permanent crown. Private practices often use dedicated or express laboratories that can craft and return a bespoke tooth in 5 to 10 days. The experience in the chair changes. Private appointments offer longer time blocks, giving the dentist room to make micro-adjustments and offer sedation. The private fee covers the physical ceramic, but it also pays for speed, scheduling convenience, and dedicated laboratory craftsmanship. We can boil all of these variables down to one physical question. Looking at this decision tree, the first thing you need to ask yourself is, where is the damaged tooth? If the problem is a molar at the back of your mouth, your priority is function. Because that tooth is hidden from view when you speak or smile, an NHS metal crown is a highly pragmatic choice. You save hundreds of pounds and secure a durable repair, but will easily handle heavy chewing for the next 15 years. If the tooth sits right in the front of your mouth, your priority shifts to appearance. For a tooth in the smile line, investing in a private porcelain or zirconia crown ensures the repair goes unnoticed. The higher upfront cost buys you 2 decades of daily confidence without feeling self-conscious. Whichever route you take, Never sit in the chair without asking for a comprehensive written estimate that itemizes all preliminary work, lab fees, and the crown itself. Let the location of the tooth dictate your wallet. Keep your costs low on the invisible repairs at the back, and save your private budget for the teeth everyone can see.